Perfect. Perfect. Well, I know who they aren't logging into here, so I'll make my introduction brief. Dr. Fredere, welcome. Kandi is she is our regional director of the Upstate for DHEC, for South Carolina DHEC organization. So Department of Environmental Health Controls, I believe, Health and Environmental Control. She basically is in charge of public health for the Upstate. So no small task there. We're grateful for you. Selfishly, I am glad to see her on this call and one of the newest board members for TATT at the top. And I see a few other names on the list here that are also new to the board. And so appreciate each of your commitment and willingness to be on our program today. But Kandi, I want to turn it over to you and let you maybe give a snapshot of the state of public health for the Upstate. Thank you for being here.
Okay, no problem. Appreciate it. And while I share my screen, I'll just echo just the appreciation for the opportunity to speak today and share with y'all for a few minutes what's going on in public health in our counties and what all we think the future of public health is in our communities. So sharing my screen now, I'm hoping that y'all can see that. Dean, shake your head if you can.
Yes, we're all good.
All righty, very good. As mentioned, my name is Dr. Kandi Fredere. I'm the Upstate Region Public Health Director for DHEC and have been a lifelong Upstate member, born and raised in Simpsonville and Lawrence. So, this is my home. This is where my family is. And when I talk public health for the Upstate, this is very personal for me because this is where my family is. This is where my friends are, my neighbors are. So this is a really important topic for us. And as we focus our efforts across the state in public health, particularly in a post-COVID world, the need for us to have a keen understanding of our communities and to collaborate with our communities for the betterment of our health is ever increasing. So I'm hoping that what I share today can help give you a glimpse into some of how we approach that and where I think we are headed with that in public health. So what I'm going to do is touch on a few things, kind of who we are and what we do. So what is public health? Is it only what you've seen on the news through COVID, or is there more to it? I'll do a real brief kind of smattering of data here and just a couple of slides on data because we have tons of data in DHEC and I will not belabor the data today. But what I do want to focus on today is particularly the social determinants of health, those underlying issues that we see, that we tackle along with our partners in public health. And then how I think we're going to move forward as a public health agency in the Upstate region to tackle some of these issues. So we are divided into 12 public health regions across the state. So you see here the map that shows the Upstate region. So real nice fit with TATT at the top. The Upstate region covers all TATT at the top counties with the addition of McCormick. So we have, and my team covers 11 counties across the Upstate. And if you didn't realize it or not, we have public health departments in every county in the state. So regardless of where you are, there should be a representative health department in your county. We do have an additional WIC-only site in the Upstate, but one thing you're going to notice if you track public health and track us in the Upstate region any length of time, we are trying to do more pop-up sites, more mobile sites to really reach our more rural communities. You'll see here from a staffing standpoint, on any typical day, I have about 275 full-time staff. So from a staffing standpoint, that is a very small number of staff to cover 11 counties across the multitude of programs and issues that we work on. But it's a great team and very committed team to public health. When you look at the services that we offer, we literally provide services from birth to death to everyone in our community. So whether it's looking at women and infant and children and providing nutrition education to moms prenatally up through the child's 5th birthday, to providing postpartum newborn home visits to moms and babies. We have our family planning and reproductive health services that provide free or low cost family planning and STD services. Children and youth with special health care needs covers moms and kids who have special needs and need special case management efforts up until the child's 18th birthday. A big piece of what we do is surveillance, investigation, and treatment. So you probably heard a lot through COVID about us doing case investigations and contact investigations. A lot of people didn't realize that we did that long before COVID on a multitude of issues and concerns, whether it be TB or STDs, whether it be measles, mumps, rubella, pertussis, varicella. There are a number of issues that we do a lot of follow-up on to help prevent the spread of disease and infection. So that's a huge task for us to do as an agency. We also provide community health assessments and health improvement plans, and we work very closely with our partners to do that. And that is our guiding document for that particular area or that county to help us move forward and work through the different issues. And it gets us to policy and systems change efforts, because ultimately we want policies and systems in our communities that are supportive of good public health and that can really provide the basic foundational support for having healthy people living in healthy communities. In addition to that, we do a lot of community coalition work. Dean is a good example of us working with our community partners, and really it takes a village to do some of the things that we're trying to do and reaching out to those coalitions. So public health, when you look at the core of public health, and one of the reasons I was drawn to public health, I've been in public health for a little over 20 years now, is that it is, in my mind, where the science of the clinical medical world, and you think acute care, medical interventions, it's where that meets the art of social, environmental issues. So it's a real blending of science and art when it comes to healthcare. And it really focuses on prevention. So I joke with some of our hospital partners that our job in public health is to put the hospitals out of business so that they don't have any customers anymore. We shouldn't have an ER. We shouldn't have a need for an ER, right? Because we want to be so healthy and so productive from a health standpoint that we are preventing disease, we're preventing injury, we're preventing those quality of life issues that we know we are struggling with across our communities. And that, again, requires that we have informed communities, informed organizations, that we're working across public and private sectors to get to that more community health effort across our programs. When you look at the data, there's a ton of public health data out there that we can really drill down into. And if you have any interest in the data, feel free to reach out to me and we can drill down on some of the data points. But I'm going to share some general data with you here this afternoon, starting with life expectancy. So we look at, in public health, what is our life expectancy across our communities, and we can now drill that down to a zip code level. So if you're ever interested in where you live, how long on average people live in your zip code, you can actually go, for the most part, on 10 at the Top's website, and some of those data sets are in our data walk folders on 10 at the Top. But what you see here, if you look globally, we have countries with life expectancies that are much better than what we are seeing in pockets of our own region. So in our backyard, we have neighborhoods with lower life expectancies, lower quality of life than people who live in the very rural, less developed areas of China. Guatemala, Russia, Honduras, Mexico. I mean, these are places that you don't historically, I didn't, prior to doing this research, didn't historically kind of associate with our own quality of living and quality of life in the upstate. So we have pockets where we actually are worse than some of these areas that we wouldn't have really thought that going into this. US has an average of about 77.2 years of life, which is pretty good on the whole. We do fairly well, not as well as some of our other industrialized counterparts. You can see Canada is up above us, has a better life expectancy. But what you see is an equity issue that when you start looking at our communities, life expectancy varies greatly from one community to the next. So when you look at it at the state level, and this you can see that it's got us divided out into some different areas here. Within the upstate, we have a range of quite a range of life expectancies between 66 and 85. So that's a huge life expectancy range over our 11 counties. And there are some areas where you can literally cross over the railroad tracks and gain or lose 10, 15 years of life on average because you're in this other area. And there are multiple issues for that we'll talk about in a second. But some examples, you've got some of our downtown areas that are really struggling from a life expectancy standpoint. I tried to pull a few of those out that were kind of the worst from a life expectancy standpoint. So, you know, if you're in that downtown area of Anderson, I'm in Anderson today, you know, having a life expectancy of 67 is a far cry from if you live in the country club area of Spartanburg and it's 85. So we have vast differences and huge equity issues as it concerns with life expectancy in those neighborhoods. This also doesn't really touch on quality of life. This is purely life expectancy. So you can imagine if we overlaid this with quality of life concerns, you're going to see even more of an issue from a quality of life standpoint in some of these neighborhoods. So this is a huge concern for us in public health. This is where we start looking at where we need to fine tune and hone in and prioritize our efforts in public health so that we can start targeting some of those communities that really are struggling from a life expectancy standpoint. When you look at that quality of life piece and the average number of days adults say that their physical health was not good, we range anywhere from about 3.9 to 5 days in the upstate. So anywhere from 4 to 5 days, somebody's telling us that you know, really was not in good physical health last month. And when you look at the data, you've got Union, Lawrence, darker is worse on this map. So, you know, Union, Cherokee, Lawrence, Abbeville, they're reporting a little bit more from a physical standpoint, more issues than say Greenville is. So again, this gives us an indication that we've got some concerns from a physical health standpoint. Similarly with mental health, we are seeing that those who report their mental health was not good in the previous 30 days, a little bit higher, a little bit longer time periods in poor mental health. This is not a huge surprise to us, particularly pre-COVID or post-COVID. So about 4.5 to 5.5 days of poor mental health. Again, you're seeing Cherokee, Union, Lawrence, Abbeville reporting poorer mental health than say a Greenville does. When you look at, and this is state level data, but when you look at South Carolina and compare us to the nation, we are doing better in a couple of indicators than the average. So we tend to, in the state, do a really good job of getting our women 65 and older in for annual mammograms. So we're doing good from a prevention standpoint in that regard. We're also pretty good about getting our annual flu vaccination for those in Medicare. I imagine when the data comes out here in the next couple of years for post-COVID, we're going to see that number fluctuating some. But we're also really doing not too bad of a job on those 25 and older with a high school diploma. Again, there are some equity concerns with that in terms of the pockets where we're struggling with that. And then we're seeing that those 16 and older, that we're not seeing as many people having to seek out work. That unemployment issue is not quite as much of an issue as it is for other areas across the nation. Unfortunately, our state has more indicators that we're worse in than better. So we're struggling in a lot of areas across the state. We just mentioned the physically unhealthy days. That's certainly a concern for us. But we struggle with low birth weight babies across the state. That is specifically in the sense of African-American women. We're seeing issues with preterm births and low birth weight babies in that population. Percent of adult smokers, we are higher in our state than other states in terms of adult smokers, as well as obesity continues to be an issue for us. Driving deaths with alcohol involvement, much more of a problem for us than other states. Chlamydia cases, higher for us than other states. We tend to have fewer people insured in our state than in other states. And then violent crime, when you look at it at a rate of per 100,000 population, is higher for us than our other states. So we've got several things from a public health standpoint that we really need to work on and focus on to help improve the health of our state. So underlying issues, the things that we can start kind of thinking through to try to prevent some of these issues and try to start improving the health of our communities are things that we call social determinants of health. So I want to talk to you a little bit about social determinants of health, and when we say that, what that means and how important it is for us to partner with our other partners. Because public health can't do it on its own. My 275 staff across the 11 counties can't on their own tackle all those issues that we just talked about. Our hospital systems can't tackle those issues by themselves. So we've got a variety of different things that we are working on. And when you look at the issues related to obesity, tobacco use, infant mortality, some of the vaccine issues that we have, and vaccine preventable conditions. When you look at some of the STD issues we have, there are underlying and undercurrents of things that we can start improving on that would help us in the long run and help prevent disease and help prevent early death, premature death. And so we've got examples here of 5 different, what we call social determinants of health. So generally speaking, in those communities where we have better access to quality education, where we have better access to quality health care, where we have a neighborhoods with sidewalks, safe lighting, safe policies, what we call the built environment, where we have neighborhoods with good social and community context, where there's good social support, access to social services, and then communities where we have good, stable economies. Those communities are going to fare better and have better life expectancies than communities that don't see these things. So if you think back to the slide where I was telling you the communities that are suffering the worst from a life expectancy standpoint versus the ones that are doing better, you will see in those better communities, they have better education, they have better access to health care, they have those built environments, that social piece is there, that economy piece is there. So certainly these 5 indicators here are all underlying issues that if we can start tackling some of these, the health of that community is going to improve by tackling these 5 issues. So you're going to hear public health talking about things like transportation, talking about things like sidewalks, lighting, working closely with our law enforcement partners to build that linkage with law enforcement in our communities. working closely with our education partners to make sure that that we are working hand in hand to provide that education and support our education partners in providing education in communities. Healthcare access, a good example I always use with healthcare access. You can look I live in Greenwood County. If you look at Greenwood County, it has the highest provider to population ratio, primary care provider to population ratio in the state. We have a lot more primary care providers than most of our other counties when you look at that ratio. But yet we still see significant numbers of people who don't have insurance or who can't afford the health care. So there's still access issues, and you've got to start peeling away those layers to see what it is that's impacting your community beyond just the healthcare piece of things. So we in public health are looking across these 5 areas to see how we can better partner together, work together to improve public health and improve some of our outcomes. So some examples of some of the data that we look at that drives some of our targeting and prioritizing. Adults with a high school degree or equivalent, our range in the upstate is between 81 and 89%. You can see we're still struggling. Again, darker means worse. The light color counties in this is better. So Greenville's got our highest at 89%. Cherokee would be at the lowest at 81%. So we see that adults who don't have a high school degree or equivalent may struggle to access the healthcare system a little bit more. They're gonna struggle more from a healthcare standpoint. So this is something, again, that's going to help drive us in prioritizing our efforts. I was talking about delaying medical care due to cost by county. So again, I'll use that Greenwood example. About 16.8, almost 17% of people in Greenwood say that they've delayed medical care due to cost. Now that's in spite of us having a fair number of primary care providers in Greenwood. So how do we go about working across our communities and talking to our hospital partners, talking to our primary care provider partners, talking to others about how we can really think through and implement some programming and policy work that will help us and help our communities access care better, because we don't want people delaying care due to cost. Certainly, if you delay care due to cost, a lot of times it's the situation is only going to worsen and it's going to even be more costly in the long run. So we've got a fairly wide range here from like 13.5% all the way up to 19% in Union County of those who are struggling from a cost standpoint. We look at housing as an issue. So certainly housing is a stressor on families if you've got overcrowding issues, if you can't afford your housing, if you have a lack of facilities and plumbing and things like that. And we've got some counties that are struggling with that. So here you've got Pickens, Lawrence, Greenwood, and Abbeville that are struggling a little bit more than some of their counterparts in terms of dealing with some of these housing issues. We hear it from some of our staff who go out and do newborn home visits and other home visiting programs that some of the conditions that our families are having to face are very difficult and can really lead to poor health outcomes. You're prioritizing your housing what little you can afford. And healthcare may not be the priority when you're faced with household issues. I was at an event a few weeks ago where an individual was talking about homelessness in Greenville County and said, if you ever want to be really impacted, go stand outside the low rent hotels on Augusta Road in Greenville. Around 7:30 in the morning on a school day, and you'll see the school bus pull up to some of these very dilapidated hotels, and the kids who live in those hotels are getting on the school bus to go to school. So we really need to start thinking as a community what that means for our families and how we might be able to help our families have more stable housing and better housing. So how we move forward, where we go from here, is to me exciting. I think there's a lot going on in public health that is positive. I think we learned a lot of lessons in COVID, that walking out of COVID, we want to tap into that energy, tap into those lessons, and really try to think through how we can take that energy and move forward and keep improving. One of the concepts that you hear and that there is a lot of focus on right now is that of equity. And there's lots of conversations about equity and equality across a lot of different genres right now. For us in public health, and particularly, you know, as I go out, my teams go out and have conversations about equity, it really is, in my mind, looking at our communities across racial and ethnic boundaries, across gender boundaries. But beyond that, let's look at rural communities versus our more urban communities. Let's look at the different age groups that we're working with, different religious affiliations. This is equity, in my mind, is really honing in on your specific community and what the needs are for that community and what the resources are and the strengths in that community and capitalizing on those strengths. So for me, working across 11 counties, if I'm working in Simpsonville, I'll pick on Simpsonville, my efforts in Simpsonville should look different than my efforts in my hometown of Ware Shoals right now, because Ware Shoals is very different than Simpsonville. Abbeville, very different from Spartanburg. So shame on me if my approach, my systems, my programming, if it looks exactly the same from community to community, because our communities are different. What they need is different. What their resources are different. And what they are prioritizing is different. So if I'm taking an equitable approach, I'm going to customize those programs and those processes for those communities to meet their needs. We are certainly, as an agency, committed to advancing health and environmental equity. And you do that through awareness, improving access to services, continuously engaging our communities. That's probably one of the most important things on this list is that engagement piece. Talking, listening, less talking, more listening, really, quite frankly, on my end. In terms of engaging our communities and listening to what is important to them and thinking through and informing our communities through that equity lens. We do have a state health improvement plan that is being revamped this year, and a lot of assessments are going on right now to revamp that state health improvement plan. This is an incredible resource for us in the state. It's something that at the state level, it gives us our marching orders of things that we want to improve upon. This is then translated down into the local community level and down into the local level to do that customization and think through, okay, it's good at the state level, but how do we apply that more at the local level? And that's where my teams really have a lot of conversations with our community partners to collaborate in what we call community health improvement plans, or here you see it's labeled as a CHIP, Community Health Improvement Plan. And this is a little dated, but this is the latest I had on this, but we are fortunate in the upstate that we've got a lot of community partners who are very engaged in looking at community health improvement, kind of sitting around the table, putting all the toys on the table and seeing what it is that we can do as a community to improve the health of the community. So big state plan is great, but it's much more impactful for us if we're sitting in Pickens County talking about Pickens County issues, Pickens County resources, what's going well, what's not going well, and what are our priorities. Might mirror the state to some degree, but there's probably some things that are very different too that we want to hone in on. We also are looking at continuing to do data walks, and a big thank you to Dean and Justine and their teams. TATT at the Top has been a huge partner to us this past year to help conduct data walks. And I think we're set to be one of the only regions in the state that have done county level data walks in every single county in a year's time. Data walks, and you see some pictures of them here, are where you actually literally walk around a room, engage with the data. We have experts at the different stations who are going to talk you through for your county. What is maternal and child health in your county? What does it look like? What does infectious disease look like and trends look like in your community and your county? What is the life expectancy in your county? And every single one of these I've been in, we've had aha moments where people go, oh, wow, I didn't know that was an issue. Or, wow, I didn't know it was that big of an issue, or start asking questions about, well, how is this over here connected to this over here? And what do we need to start doing to start addressing some of those issues? We've also seen very consistently in those data walks that behavioral and mental health has popped out as either the #1 or #2 priority in almost every one, if not every one, that we've done thus far. So we are keenly aware that behavioral mental health is something that we have got to start getting a handle on across our communities, because that's what our communities are telling us. Hey, we've got some concerns there. And those data walks, by the way, the data for those are housed on the TATT at the Top website if you're interested in seeing the data. I always like to highlight our team in action and kind of brag on them a little bit for some of the great work that they do. You see on the left-hand side here, our Region Medical Director, Dr. Carlson. So even at the leadership level, we're not afraid to don PPE, full PPE gear, and go out on, I think this was maybe Labor Day weekend a year ago, 100-degree weather, to provide COVID testing. And so, you know, we had COVID testing and vaccination clinics, hundreds and hundreds of clinics across our 11 counties during COVID. And the team was very quick to gear up. This was at the old Dodge dealership site in Spartanburg. We took over that site and we're running cars through fairly quickly through that site. So literally out and about, going anywhere, anytime, anyhow to get things done. The other picture here, again, with TATT at the Top, was a great partner for us to do podcasts called Focus on Health. And we hope to continue these podcasts that really look at some of the data and some of the issues that we're tackling in more of a detailed form than what I'm doing here today. But you know, Patrick, who is now our Health Protection Director in the region, did a great job talking through outbreak response for us. So if you're interested in that, again, you can access those on the TATT at the Top website. We also have mobile capacities, and we're increasing our mobile capacity. So when I talk partnerships, VCOM, you see their big mobile medical unit there on the left. VCOM has been a tremendous partner for us. And what you see there is their mobile unit, our mobile WIC unit. When you combine that, it's basically a mobile health department there, providing screening, testing and screening services, as well as WIC services at a local treatment and rehabilitation center. So we're going mobile. The team on the left or on the right there is actually in a detention center in that picture. So we actually go into detention centers providing testing and treatment and vaccinations as well. So we'll go anywhere to provide that service. I always like to end with this, a quote that I've stolen shamelessly from an APHA conference a few years ago. If we fail to work with a community, what we intend to do for a community may actually be something we do to a community. And our goal in the upstate region is that we're working with our communities. It's not our stance that we're coming in to save the day, that we know better than anybody else. We are often, saying to our communities, you know better about what the needs are in your community. We're here to help guide that process and help facilitate that process. So you see my team there. That's our agency logo at our region day, us trying to form out our agency logo. But we have a fantastic team in the state, a small team, but a mighty team to conduct all those services across 11 counties. And it certainly is something that I think as we talk more and more in our communities, we're seeing more and more of those linkages about how we can work closely with our partners to affect some really positive change across those counties. So that is public health in a nutshell. That's who we are, what we do. I could probably talk another 5 or 6 hours on what we do because I just hit the highlights. But great team, and it's something that we are very proud of the great work that we do.
So Kandi, I know you have to run here in a couple minutes, but I do want to touch on a couple of the questions we had, and I wonder if maybe you or Lily or someone from your team can answer some of the others that are in chat after we finish. I'm going to start with one that connects to what we've heard a lot in the data walks, and it's from Evelyn Blakely, and she asks that news reports are saying there's a rise in medicine-resistant venereal diseases. Is DHEC working with community partners to educate citizens? And we've heard through the data, Evelyn, that we've seen there is quite a rise in some of these. And can you talk very briefly about what DHEC is doing in that realm?
Mm-hmm. Yeah, so I did not focus too much on STDs, but if you want to get shocked or want shock value, we can talk about STDs. But we are seeing a rise of STDs in our community. But there is an associated rise in those antibiotic resistant strains. It is something that is concerning for us because as we have what I call repeat offenders from a disease standpoint, you continue risking this antibiotic resistance. So we do have some systems in place in our communities. One is that gonorrhea, chlamydia, syphilis, and HIV are all mandated reportable conditions. So if anybody has one of those conditions, if they test positive at their physician's office, then that physician has to report that to DHEC, and then my team has to go in and follow up with that individual, follow up with their contacts, get them in for treatment as appropriate to try to curb the spread. So that's one way we can try to curb some of that. Those teams are in continuous conversation with different primary care providers. STDs are a field that, particularly when you look at syphilis, it's something that it's not the easiest to diagnose. Sometimes it can be misdiagnosed. But there is a lot of conversation with our providers. There's also what we call a health alert network, which goes out to providers. And I know over the years, I've seen a few related to this topic just to try to educate on that issue. Quite frankly, it's something that if we had the resources, we would do more of in terms of educating providers, because that's an area we certainly don't want to go down that road if we can try to avoid it.
Sure. And the last one from John Miller wants to know, and you talked about what's next, what it looked like moving forward, and he asked about the future of genetics in improving public health.
Mm-hmm. So certainly, I think that genetics is that conversation that we are going to see more of in public health. We're fortunate that we have the Greenwood Genetics Center in our own backyard. That's a good partner of ours. So yeah, I think there's going to be more and more room for that conversation. I'm particularly interested in wastewater analysis because there's a lot that can be done with wastewater analysis and surveillance. When you look at things like even tobacco use, we can see tobacco use in wastewater surveillance. So I think there's a number of ways that we can surveil and get data. I think the genetics piece of it too, there's a lot of conversation around that. Probably about, I've seen different numbers, 60 to 70% of the issues that we're working with don't necessarily have a genetic component to it. But is certainly an area that we don't need to ignore either.
Great. And as I said, there are a couple other questions in the chat. If Lily or someone can maybe touch on those or where people can go to find that, we would appreciate it. But Kandi, thank you so much for being with us. And I can echo what you said. You have an amazing team. We have worked with them. We've been fortunate over the last year, and moving forward, we plan on continuing to partner. I think there's a lot of synergy in the upstate to work collaboratively, and I appreciate you and your team's willingness to understand that there's a lot more to working around public health than just simply the medical components. So I think it speaks a lot to how we can address collectively some of these issues. And so thank you for your leadership and the work of you and your team.
Absolutely. We'll follow up on the questions in the chat. I'll also put my email in the chat so that if anybody has any questions or has any data that they want to get their hands on, they can email me and we'll get that to them. But appreciate the opportunity and look forward to continuing to partner and tell that story of all the things we have going on. But I appreciate it.
Great, thank you. And Justine, I will turn it over to you to introduce our new team members and then the resource updates.
All righty, thank you very much. I have the honor today of introducing our new communications coordinator, Annalise Lewis-Abrams. We're so excited to have her. She has many different talents that I won't go into because she'd kill me. But did you want to just say hello? Say hello, Annalise.
Absolutely. Hi, everybody. Like she said, I'm Annalise Lewis-Abrams. I'm super excited to be joining the TATT team as communications coordinator. I am from Spartanburg, proud resident of Spartanburg. Previously worked for the city of Spartanburg in a similar capacity as their communications specialist. So I recognize a few faces on here from my time with them. So super excited to start this journey with TATT and keep growing and strengthening the upstate.
Thank you. And then we also have one of our interns on with us today, Michael McClear. Michael, why don't you just pop in and say what you're majoring in and where you go to school?
All right, I'm Michael McClear. I go to Clemson. I'm a senior and I'm majoring in political science with a concentration in American government and a minor in nonprofit leadership.
Well, we can see he's an underachiever, just like the rest of them. Thank you, Michael. We look forward to hopefully getting him out to meet some people. He's got limited time since he's doing classes, but we've enjoyed having him around and it's so helpful. So let's move on to our resource updates for today. First, we are going to have, let me share my screen. Beth Messick from Jasmine Road is going to talk to us for a couple of minutes today. We're looking forward to hearing about Jasmine Road. Beth?
Hey y'all, how are you today? I'm excited to be here. I am a Greenville girl, a South Carolina girl. Jasmine Road is South Carolina's first and only long-term residential program for adult female survivors of human trafficking, prostitution, and addiction. And I'm sure that y'all were as shocked as I was. I'm sure by now everyone's heard about human trafficking and that it is a scourging problem in the state of South Carolina. I have spent a significant amount of time working with women on the streets of Greenville. I love the presentation on social determinants of health because it's such a beautiful dovetail of the work that Jasmine Road is doing. But when she was talking about those low-end motels out on Augusta Road, that is a place where a lot of the women that come to Jasmine Road have actually wound up and spent a significant amount of time on the streets of Greenville, as well as on the streets all across our state. And so we are a 2-year long-term program. Our mission is simply to heal and employ adult female survivors. And the way we do that, we're a housing first model. So we provide 2 years of safe housing. And we also have a partnership with Bon Secours St. Francis that provides 100% free medical care for all the women that come into our program. We also have dentists, the pro bono dentists. So all the ladies that come to us have dental care and dental support as well while they're going through our program. We have over 50 community partners that deliver services to the women. They do therapy. They have horse therapy. They have horticulture, they do art classes, and a lot of different therapeutic modalities, as well as individual therapy. We have partnerships with the YMCA. We provide financial literacy. We partner with United Ministries here in the upstate. So over 50 community partners that Jasmine Road is working with. And our goal was simply not to reinvent the wheel, but really dig into the community and find who is doing work and who's doing work well. When you think about human trafficking, if some of y'all saw the Attorney General's report that just came out in January, Greenville was #1 in reported cases of human trafficking this year. We always, since this report has come out the last 4 or 5 years, we hover in the top 5. Greenville and Spartanburg were both in the top 5 this year, and that is reported cases of trafficking. We have had over 300 applications for residency since we opened our first home in 2018. So we got our 501c3 in 2016, opened the first home in 2018, and then we opened one home to serve 5 women, and then in 2020 we opened our social enterprise lunch cafe, Jasmine Kitchen. If any of y'all are on here and live in the upstate or been in the upstate, please stop into Jasmine Kitchen, 503 Augusta Street. But we're a lunch cafe, and our social enterprises are simply a business with a mission, and that mission is to support Jasmine Road by providing sustainable job skills for the women and employment for the women that come into our program. So all the women that come to the program are employed either with Jasmine Kitchen or with our candle making and jewelry making enterprises. So there are jobs built into the program while they're in our program for 2 years. We also do financial literacy. We have partnerships where the women can, if they don't have their GED prior to coming to Jasmine Road, they're required to start working on that. We've had 2 graduates that have graduated from Greenville Technical College with a degree in Health and Human Services. We've got two ladies currently in our program that are enrolled in Greenville Tech. So education is a huge piece of the service delivery that we're doing. And I was thinking through when we were talking about social determinants of health, economic stability, that is the goal of Jasmine Road. And the goal is to graduate women back out into our community who are successful and sustainable. So they start their work careers with us. They can continue to work at Jasmine Road upon graduation, or they can launch back into the community and in other jobs as well. So all of our graduates are in long-term recovery, are safely housed, and are working full-time. So as I may have mentioned in the beginning, the population that we serve are specifically human trafficking, prostitution, and addiction. So those 2 things in common, prostitution or trafficking, the commercial sex trade, along with a co-current addiction. And so the women that come into our program will tell you trafficking and drug addiction, prostitution and drug addiction go hand in hand. I need the drugs to turn the tricks. I need the tricks to get the drugs. And another thing that I believe that when you're looking at the social determinants of health that is so important for Jasmine Road is relationship. We provide relationship for these women and support. It's a free program, and they, I always say every day I have the opportunity to love women back to life, walk beside them as they heal, and help them become the people they were created to be. Providing access to services. These women have been on the streets and in a marginalized population that really has lacked access because of the neighborhoods that they grew up in. A lot of the women that we work with have come straight from incarceration. So we are really a reentry program and helping folks as well to come to launch out of that criminal justice system and back into the community. I could talk about Jasmine Road all day long. One thing I do, a statistic I wanted to throw out there with that reminded me with the social determinants of health. When you think about women that are involved in prostitution, the mortality rate for a prostituted woman is 40 times higher than the general population. And 50% of that statistic comes from murder. And that these statistics came from the American Journal of Epidemiology. And so these women, the lifestyle that they have been living, and if you can imagine the immense healthcare needs that these women have are just really unbelievable. So, we are excited to be in the upstate, being able to provide a pathway for women to come off the streets, become sustainable, get the help and healing that they need in order to launch back into the community. And we do serve the whole state of South Carolina. We also have a few residents that have come from other states as well. well. But we opened our second home in 2022 that triple capacity. So we now have max capacity of serving 15 women. 2 of those are transitional living apartments. So affordable housing, another issue, is something extremely important to us. So we work hard to place women in affordable housing upon graduation from Jasmine Road. And again, I could talk about this all day long, but I know I'm on a time limit. So I'm going
Thank you.
to stop
Thank
talking.
you. Thank you, Beth. Go ahead and put your contact information in the chat. And then there'll be lots of people on the call who you could potentially partner with in many different ways. So put that in there, and then we wish you the best of luck with that great work.
Thank you.
Okay, next up is Jamie Nelson with Spartanburg County Environmental Enforcement, and he's got some slides, so I'm going to forward through those for him.
Thank you, Justine.
I'm
Good afternoon,
sorry.
everyone.
Let me get through the DHEC slides first. One moment. Go ahead and get started.
So good afternoon, everyone. My name is Jamie Nelson. I'm the director for Spartanburg County Environmental Enforcement Department. Our department was formed in 2000 when Spartanburg County took a look at what's the best way to be good stewards of our tax dollars. At that time, they brought animal control, litter control together. And then in 2006, they brought over 4 property maintenance inspectors. In 2018, we added our Keep America Beautiful affiliate, which is Keep One Spartanburg Beautiful. And like everyone else that stated, with COVID, we realized that there was a litter issue and someone needed to address it. So we actually brought our own roadside litter crew, and we since have. Basically, my department is Animal Planet meets Discovery Zone meets True Crimes. Okay, go ahead. So my property maintenance division, I have 1 senior officer, 5 field officers. Their major focus is addressing blighted areas. They responded to over 14,000 requests last year for service, which the blighted area lines up with our county council's strategic vision plan. Currently, we are centered around our gateways. Go ahead with the next couple of slides. This is just some photos of some blighted areas. Did those not come through?
There you go.
There we
go. So we're on our litter control division, which has 1 litter control officer position. It's frozen. We have 5 field officers, and their main focus is addressing the crime of littering. As you guys know, that is a problem not only here at our 10 counties in the top, but throughout the state and throughout the United States. So this group responded to 997 calls last year for service. All right, go ahead. Sorry, we're speeding, y'all. So this is one of the pictures from earlier, that the property maintenance, we talked about our blighted areas. This was actually a large blighted mobile home, motor lodge that we took down on the Heron Circle. We also are in the process of taking down a second one, which is located just off of Business 85. Go ahead. This is one of our pictures that's related to our animal control division. Some animal control guys, I have 6 of those, 1 senior officer, 1 cruelty investigator, which we just recently hired. And we also have 4 field officers. So one of our things that we're doing here in Spartanburg County, we're actually looking at, hopefully in the next 3 years, we'll have our own pet resource center, which will be the first time Spartanburg County's ever had a county run pet resource center or sheltering location. Go ahead. This is our T&R program. I don't know if any of the other counties are doing this. I would highly suggest it. This has actually reduced our number. We currently contract with Greenville County to hold our animals. They, when we initially started, we were taking 4,000 animals of them. Because of our T&R program, we've actually cut that down to, this past year, we took right at 1,500 animals. So that's a huge drop. Go ahead. This is just pictures of our roadside litter crew I talked about. It's actually a staff of 3 individuals. Last year, they picked up 106 tons of roadside litter. Go ahead. So this is our Keep One Spartanburg Beautiful affiliate. Last year, they conducted 45 events, 2,400 volunteers, and they removed 7.49 tons of roadside litter themselves. Go ahead. So this is just photos of the some of the volunteers that were out. All right.
There's the blighted location.
Yeah. So one of the things that we're doing here in Spartanburg County, I know that if you watched the news last night, Anderson County is taking down some blighted areas. We've actually taken down 6. We just released a contract to take down 10 more, and hopefully here soon we'll be taking down around 20 more past that. Go ahead. So this is a program, this is a joint venture between Spartanburg County, Spartanburg City, our chamber, Hope Ministries, United Way of the Piedmont. This is our Litter Hero program. So basically what we do is we hire 4 individuals for a 90-day program that are actually experiencing homelessness. So the gentlemen that you see there are actually were homeless at the time. We pay them $12 an hour. They work that 90-day program. We also provide them with case management. We provide them with life skills training. We're finished up our 3rd program. We'll be starting our 4th program, hopefully either in April or May. We've had 13 individuals go through it. 9 of them have completed the program. One of the things that you heard earlier from DHEC was talk about sustainability and talk about affordable housing. We've discovered if the individuals are not in a location such as our local mission, they, for whatever reason, have not been able to complete the program.
Oh, thank you. I went right on to Satara's. Thank you so much. That's a huge, yeah, it's a huge issue. Go ahead and put your contact info too, and then upstate companies who might be involved in somehow getting involved with what you do. We know you could talk about that for a long time too, and it's something that's going to be a continuing issue. Thanks, Jamie.
Thank you, guys.
We have a very special guest today, Satara Virabagu from Anderson. She is working on a particular Girl Scout level. I'm not exactly sure the level. And before you start, I just wanted to mention that she also needs more speaking opportunities. So she would be happy, I think, I'm going to say on her behalf, to present to your organization if you would like to have her Zoom in or attend. So I'll let you move along, Satara.
Hi, so I am working on my Gold Award. My name is Satara Virabagu. I'm from Troop 1127. I'm going to keep it short and sweet for this presentation, but this is my Gold Award, which is going towards equine therapy awareness. So you can go to the next slide. Yep, and then the next slide. So one of the main issues was limited awareness of equine therapy programs and their benefits. It's a very unique form of therapy that I don't think the public gets to enjoy. And as I've grown up riding horses since I was 7, I got to realize that it was really special and unique, and a lot of people don't get to take advantage of it. So I thought for my Gold Award, I would make a program that teaches more Girl Scouts to spread the word about equine therapy. Go to the next slide. It's really important to me, like what I just said, but also because of the well-being, the people and horses, how they work with each other. Usually the horses get a job and a home in a lot of these programs where they would not be utilized. And of course, the people have many benefits, which I'll get into in the next slide. What is equine therapy? Therapy that has activities with horses and promotes human and physical mental health. You can get to the next slide. Equine therapy, it can be riding, but it also has many more aspects, which lots of people get nervous or intimidated by the thought of equine therapy, but it is also activities such as grooming, leading, feeding, horse care, just those basic working on the ground with the horses and taking as slowly as you need to. And you can go to the next slide. Anyone and everyone can benefit from equine related activities. It's not just for a special type of person. Everyone can benefit, and horses and people like the trainers all can make it for all levels for anyone that is interested in doing it. You can get to the next slide. There's so many benefits. There's confidence, self-efficiency, communication, trust, perspective, social skills, impulse, control, and boundaries, and so much more. You can continue to the next. Some of the other benefits, I didn't edit this slide that well, but there is other animals that are there. You're outside, so you're off technology, you're outdoors with people, you're interacting with people and animals, and it's just a very quiet and nice experience out there. You can go to the next slide. That is one of the programs. So that link, which I can share, can find a program near you. I worked with a local one, Share, that is based off of Anderson. You may know them. They go to Special Olympics and stuff like that in upstate South Carolina. You can go to the next slide. So that is all I have. I'm hoping that from this you took away you got a more understanding about equine therapy, some links so you can know how to find out about equine therapy more, and that you may be interested in volunteering or sponsoring at a program. Thank you.
Thank you, Satara. Great job. That was wonderful presentation. Thanks, Mayor Roberts. He had sent me over that information to try to get Satara on, and she's went to a lot of effort to get on the Zoom today. So we appreciate it. All right, David, I think we're good.
All right. Well, good. Well, I know everybody did a great job of trying to get us closed out here at 4 o'clock. We're right on it. So I just want to thank Dr. Fredere for being our primary speaker today. Annalise, welcome. Michael McClear, welcome. Beth Messick, everybody loves your restaurant and love what you're doing. So thank you for being on. Jamie Nelson, same to you. In Spartanburg, we appreciate what you're doing. And Satara, great job. That was awesome. Good job. Good on the Girl Scouts. Good on you. And we appreciate the information on equine therapy resources. So hope everyone has a great rest of their evening and a good weekend here as it approaches. And we appreciate you being on, and we look forward to seeing you next month.